Greetings to everybody. We are starting our 39th intergenerational meeting. Today we have two young colleagues. One is young but an experienced one, Mariana Pinto de Costa, and the other a bit younger, Bernardo Fleur. The topic will be on patient involvement on undergraduate psychiatric education. Welcome, both of you. Before we start, let me try to introduce these two colleagues to you. Mariana is a senior lecturer at the Institute of Psychiatry, Psychology and Neuroscience, King's College, London, and a consultant psychiatrist at South London and Moseley National Health Service Foundation Trust. She is an invited professor at the Institute of Biomedical Sciences, Abel Salazar at the University of Porto. She is the champion for culture, equality, diversity, and inclusion at the NIHR Moseley Biomedical Research Center. She is the chair of the section of public mental health at the European Psychiatric Association and member of the Committee on Ethics. She is the academic lead of the Digital Psychiatry Special Interest Group at the Royal College of Psychiatrists. She was nominated by Columbia University, featuring in the top 100 innovative women leaders in global mental health. She has published over 200 articles, including methodology and guidance papers, and in prestigious journals such as The Lancet Psychiatry, World Psychiatry, and Nature. She supervises PhD and MSc students and teaches medical students at King's College, London, at the University of Porto. And Bernardo Flor Rodriguez is a medical student and a junior teaching assistant at the Faculty of Medicine, University of Coimbra, Portugal. Throughout his medical studies, he has engaged in various clinical and research programs worldwide. Recently, he was awarded a research scholarship at King's College in London, where he worked under the supervision of Professor Mariana Pinto de Costa. With a profound commitment to social medicine and global health, Bernardo heads the International Department of Cooperation and Development at the NGO Omnia Vincit Amor, which delivers medical care to underserved communities in Equatorial Guinea. I hope I have pronounced the names properly. If not, sorry for that. Now, we have also two participants. One is Sibel, the other Anna. Welcome both. Mariana, may I give the floor to you?
Yes, thank you so much, Bulent, for the kind introduction, and thank you everyone for being here. Bernardo, do you want to start by sharing your screen? We have like a few slides that we would like to present today. So the topic of this meeting is patient involvement in undergraduate psychiatry education. And this is a topic that is quite relevant these days. And essentially, in different specialties, there has been the concern that patients should be involved in psychiatric education, but there isn't so much evidence about how this involvement takes place. So, inspired by the work that the International Federation of Medical Students Association led, and I'm very pleased that today we have Anna Liacopolo here with us. So thank you so much for joining, Anna. She's part of the IFMSA, and I believe that now she is in this very important meeting with other colleagues in the IFMSA General Assembly. But the IFMSA has produced some documents and guidelines on how to involve medical students in different specialties. The issue and the challenge has been that there isn't so much information about how patient involvement occurs in undergraduate psychiatry education. And as a result, this was an inspiration for us to start like an international survey to understand what is the reality of patient involvement in undergraduate psychiatry education. So this notion that on one extreme, you would have patients that are very involved and they teach classes and they are supported and they're also paid for these activities and tasks. And on the other extreme, you would maybe have places that such involvement doesn't happen at all. So we wanted to know how this varies across the world and how different institutions and universities have more or less involvement of patients in undergraduate psychiatry education. So we conducted a study that was in collaboration with several associations, and you can see in the logos but also a collaboration with other people. There were two other medical students besides Bernardo that were involved in this. One was Lucia, who was also a previous IFMSA member, and the other was Tommaso Squeri, who was a medical student at King's College London. So today, Bernardo is going to be presenting the findings of this actual study and also more details about the methodology. So thank you so much for the opportunity. And Bernardo, over to you.
So first of all, hi everyone. Thank you for the kind introduction, Balance, and thank you for the introduction words, Professor Mariana. So I'm here to present this project I developed under the supervision of Professor Mariana, patient involvement in undergraduate psychiatric education. So firstly, I would like to explain our study concept, patient involvement. This concept refers to the active participation of people with lived experience in roles such as teaching, assessment, or curriculum development. And this is important because these individuals bring a unique perspective, enriching education with their experiential knowledge. And this is also interesting because this involvement can vary widely from ranging from being entirely absent to exist in a limited or partially operational capacity, or to being fully active, sustainable, and integrated. As Professor Mariana already introduced, previous research has highlighted patient involvement potential to enrich students' learning experience by adding realism and fostering deeper connections between patients and medical students, while also empowering patients and making them feel valued through their participation in teaching. Despite these benefits, this approach has been unevenly adopted across medical schools globally. Previous systematic reviews have shown that patient involvement can improve very important skills of medical students, such as communication skills, empathy, and understanding of patient centered care. While existing literature highlights the positive impact of patient involvement in medical education, as previously presented, this report from the Royal College of Psychiatrists highlights that the existing literature is outdated, country specific, or limited in scope. For example, studies often focus on general medical education without addressing the unique challenges and opportunities within psychiatry. Importantly, there is a lack of comprehensive international data on how to on how medical schools worldwide incorporate patient involvement in their psychiatry curriculum. Therefore, based on that, we aim to explore globally the scope and levels of patient involvement in undergraduate psychiatry education. In parallel, we sought to understand the specific educational areas in which patients are involved and the extent of their involvement within each area. So, in order to address the research gap already explained, we conducted an international online survey of medical schools distributed to the official representatives of the International Federation of Medical Students Associations, usually known as IFMSA, aiming to understand the current state of patient involvement in undergraduate psychiatry education. So, to understand the scope of patient involvement, we define five broad areas: teaching and assessment, curriculum development, educational resources, support and well being, governance, and administration. And the survey presented four levels, each with a description related to the specific level situation to provide a better understanding of the level of patient involvement. Regarding to the results, our study is based on 89 responses from medical schools worldwide, involving 47 participating countries across 5 continents. So we obtained responses from 23 medical schools from 13 countries in Europe, 21 medical schools from 11 countries in Africa, 17 medical schools from 10 countries in Asia, and 18 medical schools from 9 countries in the Americas, one medical school from Oceania, and finally, 9 medical schools from 3 continents in transcontinental regions, regarding to medical schools in Egypt, Indonesia, and Turkey. This diverse sample provided a broad perspective on patient involvement in psychiatry education across different regions and economic backgrounds, contexts. So, now to describe more our results, in 31.5% of the included medical schools, patients do not have any role in curriculum development. In 21.3%, they play a mainly passive role by replying to concerns from the medical schools. In 19.1%, they are consulted for specific aspects, but the decision for revision lies within the medical schools. And in 11.2%, patients play a partnership role in the development of the overall curriculum. Almost one-fifth of the respondents, 16.9%, affirmed not knowing the current situation of their educational institutions regarding the patient's involvement in the development and revision of psychiatry undergraduate curriculum. Among participating schools, in 43.8%, patients do not have any role in quality assurance. In 18%, they are informed on the measures taken to undertake quality assurance over curriculum delivery. In 12.4%, patients are consulted on the quality assurance of the curriculum delivery, and in 9%, they are directly involved with quality assurance as partners. 16.8% of our participants answered that they do not have knowledge about the patient's involvement in the quality assurance of the undergraduate psychiatry curriculum. In 20.2% of participating medical schools, patients do not have any role as teaching educators in the psychiatry undergraduate course. In 41.6%, they are passively involved in teaching or limited to paper-based presence. In 18%, they are actively involved in teaching or co-delivering teaching sessions, and in 9%, patients are actively involved in this kind of sessions and also in the design of the teaching sessions. Moreover, 11.2% of our study participants affirm that they do not know about patients' role as educators in the psychiatry undergraduate course at their universities. According to our findings, 37.1% of patients do not have any role in assessment. 25.8% have a passive role in evaluation. 16.9% have an active role, and only 5.6% are actively involved in assessing and designing the assessment. Furthermore, 14.6% of study participants lacked knowledge on how patients assess medical students' performance in the psychiatry undergraduate course. Our study also found that in 14.6% of participating medical schools, academic staff do not engage with patients involved in the undergraduate psychiatry course. In 16.9%, patients have to actively approach academic staff to get limited support. In 19.1%, academic staff periodically check up with patients and occasionally provide support. And in 21.3%, academic staff are motivated and take initiative in engaging with patients to meet their educational needs. 28.1% of the survey respondents declared they do not know how actively the academic staff engage with patients involved in the undergraduate psychiatry course. Nearly one-third of the respondents, 31.5%, reported the unavailability of explicit educational support for patients involved in the psychiatry course. 16.9% reported the provision of content-based training. 14.6% mentioned the provision of content and facilitation-based training. And only 13.5% affirmed the offer of continuous training for patients before, during, and after their involvement in education. 23.6% declared not having at all knowledge about the educational support at their academic institutions. 12.4% of our participants reported their medical schools do not provide any emotional support to the patients involved in psychiatry undergraduate course. 18 explained the support is offered, but only in cases of emergency or when requested by the patient, for example. 19.1 clarified that their medical students occasionally realize some checkup on emotional safety and well-being during teaching periods. And 14.6% highlighted the existence of continuous checkup on emotional safety and well-being during and after the teaching periods. 6% of the respondents considered they do not know about counseling and well-being support for patients involved in psychiatry undergraduate course. The results also showed that 24.7% of the included medical institutions do not provide financial support to people involved in this kind of teaching sessions. 19.1% adapt facilities to patients' needs, for example, wheelchair accessibility. 14.6% adapt the facilities, and cover the partial costs of involvement, such as transport costs, meal costs, and 9% adapt facilities and cover the full cost of involvement. Likewise, 32.6% demonstrated not knowing how to answer this survey question. This is very interesting. 41.6% of medical schools in the studies do not provide any financial support for patients' instructors. And 32.6% of study participants do not have information about this possible financial support. Furthermore, 7.9% of study participants referred the payment of a voucher token for involvement in a session or activity. 10.1% referred the payment of a compensation for involvement in this kind of teaching sessions, and also 7.9% referred the payment of a salary for patients typically involved in the educational process. This one is also very interesting. Almost half of our inquired respondents, 44.9%, do not have independent bodies within the medical school and or teaching hospital. 6.7% have a group of patients working together without an actual structure or leadership. 15.7% mention that patients have a structured, independent body, but no actual power in decision making within the medical school or with the teaching hospital, for example. And 5.6% related that patients have a structured, independent body, actual power in decision making, so a very low percent. About 1/4 of our participants, 26.9%, do not present information regarding the existence of independent bodies within the medical school and or the teaching hospital for mental health service users. 21.3% of the inquired medical schools do not have dedicated personnel to support the patients. 16.9% have personnel but not fully dedicated. 10.1% have part-time personnel fully dedicated to the patients, and also another 10.1% have full-time personnel dedicated to the patients. Regarding this question, and this is very interesting, because our survey respondents showed a huge lack of knowledge regarding to this specific question, because 41.6% of the answers were that they do not have any knowledge regarding to this question. So almost half of the respondents do not know anything about the specific personnel engaging with patients. And now a less descriptive part of my presentation. Interestingly, some of the highest levels of patient involvement were reported in low-income countries. However, notable exceptions included some high-income countries such as Sweden, where patients played a significant role in curriculum design and assessment. Also Austria, which reported the existence of full-time administrative personnel dedicated to supporting patient involvement, as well as active staff engagement with patients in the undergraduate psychiatry. Oman also is very interesting because adapted facilities and covered all costs associated with patient indicators, while Slovenia, for example, is also very good because the respondents mentioned ongoing well-being support. Bulgaria also offered ongoing training for patient educators. But the winner, I mean the highest overall levels of patient involvement in undergraduate psychiatry educations were obtained in Latin America, more precisely in Argentina. All Ethiopian medical schools in the study reported conducting regular emotional safety and well-being checks during and after the teaching periods. Bulgarian medical schools consistently paid salaries to those involved in the educational process. In Hungary, independent bodies within medical schools or teaching hospitals were generally present, albeit with varying levels of um, patient involvement, varying on the medical school response. In Romania, there was stark contrasts between medical institutions. Some medical schools reported lack of patient involvement, while others offered continuous well-being support throughout the course, with high levels of patient involvement in assessment, curriculum design, active and staff engagement with patients, and also financial support for patients educators. So I would like to summarize everything I presented. So some highlights and future steps. In fact, these findings highlight the urgent need to standardize patient involvement in psychiatry education globally. Standardization would help to establish benchmarks, to promote best practice, to ensure that patient involvement is not only like a concept, but effectively integrated into educational strategies. Addressing challenges such as the lack of financial support, administrative support, is essential for ensuring sustainability and equity. Collaborative efforts from medical schools, healthcare institutions, policymakers are needed to ensure that patient involvement becomes a reality, a more integral and effective component of psychiatry undergraduate curriculum course worldwide. The study, which benefited from patient advice in both the study design and the interpretation of findings, provides a foundation for further research. Patient involvement holds immense potential to transform psychiatry education by fostering empathy, communication skills, patient centered care among future doctors. However, inconsistent implementation and inadequate support hinder its widespread adoption. I would like to share with you that this project was accepted for publication in World Psychiatry, the most psychiatric journal, prestigious journal in the psychiatry field, and I would uh, um, so I would benefit the chance to thank to Professor Mariana Pinto Costa for her supervision and for her time, because it was a great experience to develop this project and to learn a lot with her. So thank you so much for your attention, and I'm open to your comments and questions. Thank you so much.
Thank you very much, Bernardo. I think that was a very good overview of the work that it was done. Indeed, as Bernardo said, um, the focus of this study was patient involvement in education, but we also involved patients in this research study. And the Tommaso Squeri, who was one of the other medical students who was involved in this project, he presented in a patient advisory panel in the beginning, so before the study started. So basically, patients commented on the questions and on the design of the questionnaire and the recruitment strategy. And then Bernardo also presented the preliminary findings of the study in this advisory panel of patients. And it was a very good opportunity to discuss these findings.
Thank you, Bernardo, for the presentation, and congratulations for your being able to have a chance to publish it in WP World Psychiatry. It's something very important, as you said, the most prestigious journal of psychiatric world. Yeah, Mariana, now are we going to listen to you? Or before that, does anybody want to ask anything, want to make any remark?
I think it would be interesting to hear the thoughts from the medical students here of the findings, but equally, how is the reality in your own institutions? Because Bernardo presented the overall findings, so across the entire sample, and then he showed some of the countries that for one reason or another, they their information was somehow distinct, either as the institution or the country with most involvement or the least involvement. But surely there is a wider reality that it will be good to have an understanding. And maybe there's even like someone from that country or one of the countries that Bernardo mentioned and wanted to comment further. So, so I understand that there are a few medical students in the call, and I would be very interested to learn from which institution are you studying at the moment, and what is your thoughts and views about patient involvement in your institution, or a bit more broadly, if you know. Yeah, so who wants to start?
If you want, I can start. Okay,
Yeah,
perfect. Hi, I'm Anna. I study in the University of Vienna, Greece. And I think that still maybe in my university, the professor takes most of the decisions on our education. So it's not only that there's no patient involvement, there's also no student involvement. But there are a lot of times that the professors do agree that it's something important. So they try on their own and based on their experience, for example, with their patients, because they discuss a lot with them, they are trying to apply what they learn, let's say, to our education. So there is kind of an indirect way that maybe it will be applied, but it's always up to the professor. So if it's a good professor and they really do think it's important and they really want to advance things, they're going to do it. But there are other cases that they just simply focus on the book or what is already there, I would say.
Okay, no, thank you so much for sharing, Anna. Interesting. I think like Bernardo, Greece didn't appear distinctively either like one way or another.
In fact, I think that we didn't receive responses from Greece. Yeah, I think that we didn't include Greece. But curiously, now I can share with you my perspective. When I was doing this project, I was curious about my colleagues' vision, so I checked in the results if someone from my university participated, and in fact, some of my colleagues participated, and it was very interesting because I agreed with their responses because I also consider that my university has a lack of patient involvement. Okay, so I answered like the question for myself in my mind, and I thought that yes, it would be like level 0 or 1 or patient involvement. So it's something sad because, for example, in Portugal, my country, the reported patient involvement was very low, so not good at all.
Thank you, Bernardo. So who else is where? Sit down.
Yeah, I'm studying at University of Kocaeli, and in my university, there's, I guess, no patient involvement in education, not decisions, especially. I I don't know actually some details, but I don't think there's any involvement of patients. But the students are seeing patients and the other involvement happening, but not in education, I guess. Not the decisions, especially.
Thank you, Sibel. Sorry, I didn't quite catch. Which country are you studying?
I'm studying in Turkey.
Okay, okay. Yeah, no, that's very interesting. I guess, like as you say, in education, like in some places, you see patients, but as in, like speaking with patients in the clinical setting. But beyond that, in terms of like they being involved in your educational, like course and teaching. So, for example, in some cases, you might have like students patients rating students as in like very good or not so good, so like part of the evaluation in which students also receive feedback and or grades or scoring depending on how formal on how you want to organize it from patients. And in some cases patients then also receive training to get more skilled and more support in terms of how to provide educational teaching, and in some places they are paid because like it's also time that they spend in doing these activities. So I think it's very interesting to think about this broad spectrum on how this happens in psychiatry, but equally inspired by the work from IFMSA, how this varies across different disciplines. Because today the discussion is patient involvement in undergraduate psychiatry education, but what about, how it happens in cardiology or surgery, and is it different, or is there is more or less involvement in psychiatry? Would stigma have a role? And in some mental health services, people think because people have a mental health condition, then they shouldn't be involved. And in other disciplines, like, I don't know, like surgery or diabetes or, like some other chronic conditions, for example, then our colleagues are more prone, or maybe less, in involving patients in the education of patients. So I think this is also like a discussion to have in comparison with how patients are involved in other disciplines. Ramin.
Yes, hello everyone. Yep. All right. I'm a junior doctor from Malaysia. For those who I've not met yet, it's nice to meet you. I would just like to share, I think it's very interesting, Professor Mariana, what you mentioned about patients being involved in directly rating the students. When I was a medical student in during one of my first classes in my psychiatry rotation, one of our professors actually brought in a patient with chronic mental illness, and she asked us all to basically speak to him and get to know what's at the bottom of his condition, and why is he seeking help from psychiatry. And at the end of it, he was asked to rate the group of students who actually spoke to him. So I think that exercise actually helped us to sort of reduce that sort of stigma that may be present when you're first speaking to a patient with a psychiatric illness. So I found that exercise very interesting and very helpful for both myself as well as my other colleagues at class. So, but I'm also curious, like, is there a way where we can increase the patient involvement in the education of at the undergraduate level? Is that something that we are going to be talking about today, or should we discuss that at a later date?
Thank you so much, Ramin, for sharing your experience. I think the fact that you shared that you are a junior doctor now, but some years ago when you were a student, this happens. This also illustrates that some of the results we had that showed examples of, positive cases where patient involvement already happens do exist. And it's, like great to hear like one example from you. So thank you. In terms of like the implications, I mean, I personally think that the work that can be done is both at the local level, in which each medical school has awareness about this, and we raise awareness about this, for example, through the findings of the study, so that patients are more involved in the education of students. It can also be done more regionally or nationally, depending on, the structure that different countries have in terms of medical education, or of course internationally. I mean, the IFMSA, and we have Anna here today with us, they were the ones who developed these checklists that wasn't specific for psychiatry as such. It was like a global instrument for any discipline. But perhaps, Anna, I don't know if you have any insights about whether there are more findings and if this tool was used in other disciplines, and whether from the checklist that you developed, there is some policy work ongoing, perhaps with a group of focusing specifically on education at the IFMSA level to raise awareness about patient involvement. I don't know, like, do you have any insights on this, and you perhaps can update us of what the IFMSA is doing?
Since the research like with that we did with you was quite recent, we haven't been able to use it yet with another field, but we're discussing with other medicine specializations to do something similar. And also we're discussing with patient organizations, so like also have their view on things and see what can be done.
Perfect. Thank you so much, Anna. I think it's very interesting, but also good to learn, I guess, that since you developed this checklist, we in psychiatry were the first to use it. So, well done us. But at the same time, I think it would be fantastic if colleagues from other disciplines would use the tool, and then, in the future, we could compare whether in psychiatry, like, we actually involve patients more or less, and what variations might be having across the world. And I think the work that you're doing with involving patient organizations in this is also very important. So I think this can be done at the broader level in terms of, medical education across any discipline, or more specifically like in psychiatry. Iram, I think you're joining us today. I can see that you're active. Do you want to share where you're dialing in, and how is the reality in your medical school?
Yes, I'm trying to do that, but I'm at the hospital right now. So, can you hear me well?
Yes.
Okay. Hello, everyone, and thank you for the presentation. So I'm not a medical student. I have graduated in 2022. Now I'm a psychiatry resident in Turkey. But I remember my medical education. It was in Istanbul, Turkey also. Over there, like, there weren't actually any structured patient involvement, I can say, but it was like that we had, especially in the like internal medicine units and everything, there were some can I say that experienced patients, like they were there for 3 months or so. So during our exams and oral exams and everything, they were like rating us, giving us points, even if anybody asks them. And they were like even giving us some tricks. This like professor would like to hear that. You can say that to him. I have some kind of this like that. It wasn't something structured, but they were trying to like involve and help us. But while I was in medical school, I had like two elective rotation in the United States. So I had the chance to saw the difference. Over there, it's were like during the rounds, they were including the patients. And one of my rotations was in the pediatrics clinic, so they were like including both the patient and the families. Even in the intensive care units, they were asking the families, and families were answering them. But I don't think it's much like that in Turkey, especially in the fields of psychiatry. Sometimes I feel like bad for that, but it's like there is a patient, of course, they have some kind of psychotic disorder or any kind of that, so we have to give a treatment. it is sure that they like don't have the best decision-making capacity at that time. But it is also a bit difficult to like not involving them and having decisions on their behalf. But we are trying to like do what is best for them. But I think it's especially like difficult in the field of psychiatry, because in the other field, usually you can be like at the same point as the patient, because it is easier for them to accept the problem and then come to their senses. But in psychiatry, uh, like we want to, of course, involve them, but they aren't aware of the problem, and it is difficult.
Okay, thank you so much, Hiram, for sharing. I guess, for example, like it's not specific in psychiatry education, but recently, like I attended this course, which is mandatory in the UK around how to do like compulsory admissions. It's something that it's mandatory, like every, periodically for you to do. And part of the program, there was like a patient who in the past had been admitted against their will, and they were now, like well and stable. And they, in this course, were providing teaching and also like sharing his experience about, well, what happened and how this should occur in his view later in the stage. So I think of course, like in mental health, sometimes people are very unwell and they might struggle with being very involved in teaching. But equally, patients do recover, and once they are better and in a position that they can, like reflect a bit further about what happened in the past, then they can also like contribute to teaching. So I think this is something to bear in mind. I mean, normally we use quite a lot the term lived experience, which I guess means that someone experienced that, but they moved on and they recovered, and now they are like in a place that they can reflect further and speak about what happened and teach. So just like a few thoughts on that. Bulent.
Yeah, I would like to say a few words about what I was involved during the time I was in teaching process. Actually, I'm retired from the same university Sibel mentioned. In our psychiatric teaching, psychiatric education, especially with the young students, we were visiting community mental health places. I can say they are for psychotic patients only. Although it's called community mental health centers, they are for psychotic patients. And at the end of our half-day visit to that place, we would have some discussions between the clerkship students and the patients. And I was asking the patients their suggestions, their advices for the students. And this has not been a formal participation in the education process, but after the discussion, we were going over the discussion together with the students. And it was very interesting to hear their comments from what they have learned from the patients. They would suggest to be more fair to the patients. They didn't use the concept of stigmatization, but they meant that in a way. And they were asking for proper medication, which probably meant sometimes they didn't realize it was, they were prescribed with proper medication. And there are a lot of things which they have taught our students indeed. Maybe I should have brought these together to share with you some other time. This was, I will repeat, this has not been a structured education process, but it was something which even I was the teacher, but even I learned a lot from the patients. I wanted to share that. Are you going to present any other thing, Mariana?
No, I think like Bernardo kindly presented like the work that we did, which was quite detailed. And I think this discussion was very, very interesting. I was reflecting now that there are several medical students, and then I guess myself in an intermediate stage, and then yourself, Bulent. I think it would be very interesting to have this discussion further with people from different, I guess, like career stages and generations, because in addition to this angle of the differences across different parts of the world, I want to think that there's maybe like a difference throughout time, possibly, in that maybe these days there's more involvement, especially like the very structured involvement that occurs in some parts of the world. But maybe there's good examples as well that were done in the past that might either been less formal or, or more formal, I don't know, that we could learn from. So it would be very interesting to have this discussion to know more how was patient involvement, I don't know, like 50 years ago or something.
Okay, yeah. Iran wants to say something, but before that, I would like to underline that thank you very much for sharing the results of your research. But frankly speaking, I had some difficulty in watching the results. The tiny letters. I would be pleased to have a look in detail the findings. If you can share that somewhere before you may not like to share it before it's published, but in a way, I would like to read more about that. And also the tool which Anna mentioned, is it published anywhere? Can that checklist be used anywhere? Anna?
I don't think it's published yet somewhere. From what I know, no, I don't think so.
All right. That must be an interesting tool. And maybe we will be able to listen more about that in coming future, in near future. Yes, Irem, please.
Okay. Thank you, everyone. I would just add a little thing that, like speaking about the patient involvement, that came to my mind that I had like 2 years of my clinical years during the pandemic. So they were not to mention about the patient involvement in the education, there weren't any patient in front of us, and everything was online. And that duration was also an interesting time that came to my mind while speaking about this, because like we were having our obstetric and gynecology rotation there, but it was completely online, and I haven't seen any childbirth or C-section or anything, but it was a rotation. So at that time, especially, it was an important period of time for us to understand that it is so much important to be in the hospital and be with the patients and like see them, talk with them, and everything. It is really important. I just wanted to add this.
Yeah, no, thank you so much, Hiram. I guess like just to share that some years ago we did a different study, also with IFMSA, with another colleague who was the medical student representative, called Katarina Dima. She's now like a psychiatry trainee, so that's good. And at that time, we went to investigate across the world in which medical schools there was contact with patients, either in, like practical classes or even psychiatry as a discipline. And we found that in some parts of the world, there was either not the psychiatry discipline, like at all. Like imagine, like in that country, people graduate as a medical doctor, but they didn't have psychiatry in their curriculum at no point in the other undergraduate education. Or in other countries, they did have psychiatry as a discipline, but all the teaching was theoretical and they never saw like any patient. That article was published as well, like in the World Psychiatry. So if you look into that, you can see the details of the countries in which either there wasn't psychiatry in the medical curriculum at all, or patients were not part, like contact with patients were not part of or practical classes. But I guess from that point that we did that study to see whether psychiatry was included and whether there were practical sessions, I think now, these years later, we went a bit further, not only whether there is contact with patients, but how patients are involved in education. So in this teaching angle, and providing like feedback on how students perform and what type of support and teaching the patients have if they want to contribute as what is called patient educators. So it's interesting to see like the variations, but just to say that point about patient contact, we did that in the past, and I'm happy to share the article here in the chat as well, or circulate it later on.
Sorry, I think we are at the end of our meeting. Before we close, does anybody have anything to say? All right. On behalf of all of us, I would like to thank Bernardo and Mariana for sharing their research, the findings of their research. You have shared something, I see. All right. Thank you. In April, we are going to listen to a professor from US, and the topic will be decided at SEED group. I hope Anna will join our SEED activities together with Bernardo. Okay. Thanks everyone for being with us.
Did we have any picture yet?
I have taken a few.
Okay.
But Sibel has closed her camera, I think. Let's
Okay.
take another one.
She's here.
All right. Well, I'm taking another one. Thanks a lot, everybody. Hope to see you in April.
Thank you so much, Bulent, for organizing and for the invitation, and everyone for the interesting discussion. I think it was very enlightening to discuss this with all of you.
Thank you.
Thank you for your presentations.
Thank
See
you.
you, everybody.